Hello everyone, it's Rafael. Hello everyone, it's Rafael Gutierrez. Welcome to my channel. I hope this is working out. I was looking at the different things, and what I'm going to do today is I'm going to talk about the scapula. And I actually drew it before I did the video, so it's easier for me to talk about. And before I do, I'm going to tell you guys something that I actually noticed. I have seen people post pictures of anatomy, and a lot of times what they're posting is incorrect. It's really good if you are trying to do the anatomy for you to actually just take a couple minutes and see if what you're posting is accurate. It really isn't that hard to do. I mean, there's actually a lot of resources on the internet. There's actually a lot of things here on YouTube. If you want to use me, you're more than welcome to. But the big thing to actually realize is that you have the choice to be right or wrong now. It's not like it was back 10 years ago, even actually, no, 20 years ago, before the internet was had a lot of prevalence. You can actually choose to be correct or incorrect. And so what I'm going to talk about is the scapula. Now, if you use me, for example, my scapula is pretty much the shoulder blades here. And if you feel the back, you can actually feel, on me it's about here, you can feel a lump of bone. That's this here, which is called the spine of the scapula. Now, if you feel the spine of the scapula and move your scapula around, you'll notice that your scapula moves. Now, what happens is this is actually the bottom part. So here, the ribs would be attached here, and it allows the scapula to move up, down, forward, and back. Now, there are different things that are important with this, and there are some vocabulary words which are nice for you to know, especially if you plan to study more anatomy than this. And this is a great place to talk about it. If you're talking about something being on the middle of the body, we call it the medial. If it's away from the body or outside, we call it lateral. And I'll just put an L for lateral. My pen's not working too well right now. There we go. So we have medial and lateral. We also have superior and inferior. So this would be superior up here, inferior here. Superior, inferior here, superior, inferior here. So it would be actually the same. So where your arm is going in, which is where this little lump is, or here, that would be lateral. So we talk about lateral borders sometimes, and it's this border right here, the outer area of the scapula. Medial border would be this one here. In this case, it would be this big one here. And then you also have the superior here, superior here. You also have angles, superior, inferior, and lateral. You also have something called the spine, which is what I had you feel. And that's how you know that you're actually looking at this. Now, there are a lot of other projections. Some of these are important for muscular attachments. For instance, this little finger like here coming off is called the coracoid process. Coracoid process, it actually attaches to a muscle called the coracobrachialis. It actually comes there and comes in. I'll talk more about it. You also have spine, and you have this hangy thing here, which is called the acromion. Now, the acromion is attached to another bone, which I'm just going to mention, and I'll draw it in, called the clavicle, which is a collarbone here. So if we were to draw it out here, the clavicle would come from here and go all the way to the sternum. Over here, it would actually come across the front here. So the clavicle connects to the acromion of the scapula, forming a little nice triangle, which your arm sits around. The reason I'm actually mentioning that is your arm, your humerus, which we talked about last time, is going to sit in here. And if we actually draw it over here so you can see it, you'd see the big head of the humerus over here. And what you notice is, unlike all the other joints that we've talked about, the humerus isn't really well attached there. Now, there is a reason we want that. One is so we can end up getting a lot of movements in our forearm. All this movement, our shoulder, all these movements are only able to be done if you have a loose glenohumeral joint. That area here is called the glenoid cavity, where the humerus comes in as a humerus. So it's the glenohumeral joint is where it comes together. And it is relatively loose. Why this is important why this is important in martial arts, it has to do with a lot of techniques. For instance, if you think of shoulder locks, There, once you actually have them in, someone has almost no power to do anything. It's actually a lot for me, anyways. It seems it's easier to do a shoulder lock than a lot of other locks, mostly because there are different things that you can do with other joints because they are better attached. Now, if someone gets a shoulder lock in and continues, it will actually pop the humerus out of its socket. Usually that's actually an anterior dislocation, about 90% of them, and it would actually rest on nerves. That's actually one of the problems with dealing with the humerus with martial arts. You do have to be careful, and why it's important if you are doing a lot of joint manipulations to learn a tap. You can also do it the other way, and you can get a posterior dislocation, which is a lot harder to do, but it can happen. And so now you can actually see how these bones come together. And again, you have the clavicle here, the collarbone, and it has an acromial end, which touches the acromion of the scapula, and you have the sternal end, which comes to the sternum. Now, I am going to draw it out here and here with my trusty marker. So if I come here, it's going to come this way like this. And if we look at it, it actually has a bit of an S shape. The clavicle. So you have the sternal end, which usually is a little bigger on the side here, and the acromial end, which becomes flat on the side where it actually goes into the clavicle. By the way, some people actually will tear that, and they'll just the joint between the clavicle and the acromion, and that will actually cause a destabilization of the shoulder. So will a fracture of the clavicle. If the clavicle fractures, a lot of times it happens by falling. So someone falls and they actually hit straight here, the clavicle can fracture. It will cause a complete destabilization of the shoulder, meaning that you'll actually end up having the shoulder come out of the joint and rest pretty much on nerves again. It can actually be broken also with blunt force, but usually it does occur from falling. Sometimes actually on an outstretched hand. That's why if you do a lot of throws, it's really important to practice throws. So with this, I will actually mention, I have actually covered from the tip of the fingers all the way to the shoulder. You do have ribs, which I will talk about later. And we do have the sternum, which is up in the front, has other reasons. And as people study this, there is actually a chance to be able to get a full understanding of anatomy. Next time I'm going to do the legs, and the legs will actually go really quick because most of the things I'm going to talk about are exactly like they are on the hand, a couple of different variations. Please remember that things are actually going to come up over and over again. For instance, lateral and medial will actually come up over and over. Spines will come up over again. We actually talked about the styloid processes. Those will actually come across as we talk more about bones. And lateral and medial I already mentioned. I hope you enjoy this. And one of the things you'll notice is I'm also mentioning the joints. The joints are pretty easy to figure out what they are because they're usually named for the bones that are actually touching it. So the acromioclavicular joint is over here. The sternoclavicular over here. I haven't found a real reason for why it's one way versus another. If you find something that makes sense, please let me know. I hope you have a nice day.